Restoring testosterone levels naturally involves adopting a healthy lifestyle and making dietary and behavioral changes that support hormone balance. In this video, we will discuss some strategies that may help in order to restore testosterone level. Maintain a healthy weight. Being overweight or obese can contribute to lower testosterone levels. Aim to achieve and maintain a healthy weight through a balanced diet and regular exercise. Exercise regularly. Engaging in regular physical activity, including both aerobic exercise and strength training, can help boost testosterone levels. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week, along with muscle strengthening activities on 2 or more days per week. Get sufficient sleep. Adequate sleep is essential for hormone regulation, including testosterone production. Aim for 7 to 9 hours of quality sleep per night and establish a consistent sleep schedule. Manage stress. Chronic stress can contribute to imbalances in hormone levels, including testosterone. Practice stress reduction techniques such as mindfulness meditation, deep breathing exercises, yoga, or spending time in nature. Eat a balanced diet. Include nutrient-rich foods in your diet that support testosterone production, such as lean proteins, healthy fats, whole grains, fruits, and vegetables. Avoid excessive consumption of processed foods, sugary snacks, and high-fat meals. Consume healthy fats. Healthy fats, such as those found in avocados, nuts, seeds, olive oil, and fatty fish, are important for hormone production, including testosterone. Include these foods in your diet regularly. Limit alcohol consumption. Excessive alcohol consumption can interfere with testosterone production and metabolism. Limit your intake of alcohol and avoid binge drinking. Quit smoking. Smoking cigarettes has been associated with lower testosterone levels. If you smoke, consider quitting to improve your overall health and hormone balance. Stay hydrated. Drink plenty of water throughout the day to stay hydrated. Dehydration can negatively impact hormone production and overall health. Consider dietary supplements. Some natural supplements, such as vitamin D, zinc, magnesium, and D-aspartic acid, have been shown to support testosterone production in certain individuals. However, it's essential to speak with a healthcare provider before starting any new supplements, as they may interact with medications or have potential side effects. Limit exposure to endocrine disruptors. Minimize exposure to environmental toxins and endocrine-disrupting chemicals found in plastics, pesticides, and certain household products. These substances can interfere with hormone balance and testosterone production. Consult with a healthcare provider. If you suspect you have low testosterone levels or are experiencing symptoms of low testosterone, such as decreased libido, fatigue, or erectile dysfunction, consult with a healthcare provider for evaluation and personalized recommendations. They can perform hormone tests and provide guidance on appropriate treatment options, which may include lifestyle changes, hormone therapy, or medications. By implementing these strategies and adopting a healthy lifestyle, you can support testosterone production and overall hormone balance naturally. However, it's essential to consult with a healthcare provider before making significant changes to your diet, exercise routine, or supplementation regimen, especially if you have underlying health conditions or are taking medications.